Okay, we're on, right?
Yes.
Yes. Questions?
I know we want to talk about that week 10 email we got.
Seriously.
Yeah.
What?
The week 10.
Okay, what about it? Can we talk about that later? Because it's... Okay. Okay, so... We're going to have a teach back. We're going to have a teach back on... related to the topic. We're going to talk about the central nervous system, particularly what? The brain, right? We're going to talk about the cranial nerves today, right? We're going to talk about the autonomic nervous system. We're going to talk about what? The sense organs, particularly what? The ear, and then what else? The eyes, right? Okay. So are these important topics? Definitely, right? Okay. In as much as, I just want to be sure, I always do this, I'm obsessive compulsive. Is it REC? What does REC mean? But I will not be talking for 1 hour and I'm not doing anything, right? Okay. When we say central nervous system, 2 organs. What are these 2 organs? Brain and what? Okay. So another way to do things aside from making tables is to come up with a concept map, right? And using a what? A whiteboard and a marker. You can buy this for 99-cent store. 4 pieces would only be $1. You can buy this at Walmart for what? $17, $17.99. The big one if you want. But the small one is probably, I got 2 of that, $10 each, $20 I spent, right? So what do I do? So I'm going to test myself, okay? So I need to know about a structure. I need to be able to talk about it without looking at my notes, right? Okay, such as what? So we talk about the brain, right? And the spinal cord. So when I say CNS, it is not CNN, but rather what? CNS, central nervous system. You think of what? Brain and what? Okay. We have discussed the spinal cord last time. Today our topic is purely on the brain. Okay? We know the brain is so important because it's made up of billions of nerve cells, otherwise known as what? Neurons. At the same time, what do you call those supporting cells again? Neuroglia. Glial cells. You have more glial cells than the neurons themselves, but between the two, which one will transmit the nerve impulses? The neurons or the nerve cells. The glial cells are there to support and protect. That's all they do. So we talked about this last time too, about the glial cells now. So our main concern today is about the human brain, right? We know that the human brain is protected by first what? The skull, right? The skull is made up of 2 parts. The cranium, upper part, and the facial bone, right? Obviously, the cranium, together with the facial bones, protect the heart, the brain. Why? Because the brain is soft, while the skull is hard. It's supposed to protect it, right? But despite the fact that you have a skull, what happens if you have a skull fracture? Or somebody hits you with a baseball bat? Or you fall from a 10 feet high or 10-story high building? Can your skull sustain a skull fracture? Can that damage the brain? Can you have traumatic brain injury therefore? Yes, you can. So in other words, the skull is not enough. Even wearing a helmet. How many of you drive motorcycles here? Okay? You drive motorcycle. Who else? Okay? You drive a motorcycle. Now the question is, can that completely protect you? No, it cannot, right? Okay? So even though you have a helmet, it can sustain a skull fracture. Okay? Now, after the skull, what comes next? What's it called, that membrane that protects the brain and the spinal cord?
The meninges.
The meninges. So every time you hear of the meninges, you think of what? What are the 3 parts of the meninges? Dura, arachnoid, and then what? Okay. Dura mater. You know what the word mater means? Mater means mother. Dura means tough mother. How many of you have tough mothers here? Okay. How many of you have delicate mothers? Pia mater. Okay. Delicate or soft, right? Okay. So the delicate mother is pia mater. So sometimes you have a mom who was both tough and delicate. Like me, my mom was very tough on me not having what? Girlfriends when I was in grade school. Tough on me on not having a good time when there is an exam the day before. Tough on me on waking me up at 4 in the morning because it was my intention to wake up at 4 in the morning when I was 10 years old. Why? Study. Why at 4 in the morning? Because there was nobody who would bother me. that my younger brother would like me to watch black and white cartoons. It's in the late 60s and early 70s. But at the same time, delicate and not, just a typical mother who would prepare what? Chocolate milk. I remember that. Milo. M-I-L-O. Every time you go to an Asian store, if you see Milo, that's what Dr. Gamo used to drink. You can give it to your kids, right? Have you heard of Milo? M-I-L-O? No. Maybe not. Or Ovaltine. Now, anyway, the bottom line, therefore, was you have a tough mother and a concerned mother. Okay? Now, arachnoid refers to what? The appearance. It looks like what? The spider web. From the word arachnida, right? Now, so if I ask you now, which one is the topmost layer? If I ask you which one is the middle layer, which one is the innermost layer? Okay, so if I ask you therefore, what is the name of the space above the dura? And because what does epi mean? What is the name of the space below the dura? Because what does sub mean? Okay. What do you call the space below the arachnoid? Because what does that mean? Is there such a thing as epi-arachnoid space? Huh? Why? Because that's also known as what? The subdural space. Why do we have to call it epi-arachnoid when it already has its own name? Do you understand?
Yes.
Now, my biggest question is, where would you expect to find the cerebrospinal fluid? What space? Subarachnoid space or subdural space? Subarachnoid space or subarachnoid space? Repetition is the mother. A while ago when I said, where do you find the CI? Somebody said subdural, somebody said subarachnoid, right? So every second counts here, right? Every second. Time is of the essence. We can't afford to have a nurse who is what? Confused? A confused nurse is a dangerous nurse. I'm just joking, of course. That is why we are here to what? Get rid of the confusion and make sure you understand what we mean. So dura, arachnoid, and pia. So make it even easier for you. You can draw a brain like this, a very simple brain, like a whale. So what's the first layer? What is found on the surface of the brain?
Zero matter.
Oh, see? Surface of the brain, already a mistake.
Zero matter.
That's the reason why it's called innermost layer. Because it's on the surface of the brain. And what is that called? Pia. What is the middle layer? And you can even have a different color, just like her. Let's say blue. And what's the third layer? It's blue and then it's red. Oh my God. Blue cover with a red. What the heck? And this is now the real blue. What is this?
That's a dura.
Dura. Followed by? Followed by? So before you open your mouth, you have to think what? First, what is found on the surface of the brain? What is the middle layer? What is the topmost layer? Outermost layer? Top layer? Tough mother? Hi, my name is Dura Matter. What is your name? Tough mother. Outer layer. Okay? So what is the space above the dura? It's below the dura. And below the arachnoid. And where do you find the CSF? Now, you might be wondering, I will jump. Okay, bless you. I will jump. Usually say jump the gun, but jump the topic. So you would say, Dr. Gamo, I'll be a future nurse. And in the nursing board exam, it's usually case scenarios, which means what? They won't be asking you what is the topmost layer. No, they want is the lowest layer. No. They'll give you a case, a clinical condition. Say, the 70-year-old male patient was walking in the corridor of a nursing home and slipped and fell and sustained a skull fracture. At the same time, he developed what we call a subdural hematoma. So where is the hematoma? What does hematoma mean? An accumulation of what?
Blood.
That means if there was blood accumulating, there must be a ruptured what? Vessel, right? Okay. Now, another case is a 25-year-old, no, let's say 20-year-old male, 19-year-old male who was driving a motorcycle, who was drunk, fell or hit the head on the pavement, walked towards the hospital and say, I have a severe headache, has projectile vomiting, and suddenly passes out. On CT scan, the blood was found above the dura. So what kind of bleeding is that? Is that epidural bleeding or epidural hematoma?
Yes.
Because epi means and sub means? Okay. So the 70-year-old male had a subdural and the 19-year-old male had an epidural hematoma. Now this will come out in the nursing board exam, and why do I know? Because I've done many times of review for this. I've gone all over the questions for almost 8 to 10 years. My biggest question to you is, which do you think is more dangerous? Subdural or epidural?
Epidural.
Subdural or epidural?
Epidural.
Okay, who says epidural? Who says subdural? Who says I did not raise my hand? Who says I don't really care? Number 4, I don't mind. Okay. Now, the correct answer is what?
It's epidural.
Epidural. And why would that be the?
Arterial bleeding.
Why would it be arterial bleeding, my dear?
It's faster.
It's good.
What is the name of the artery there?
Meningeal artery.
There.
You're the man.
Thank you.
Remember? These are all meninges, right? What's the name of the artery?
Meningeal artery.
And what's the name of the vein?
Meningeal vein.
Don't you love anatomy?
Yes.
The first time I saw, it was called Love at First Sight. The first time I saw the anatomy book, I got in love with the book. Oh my God, I love you, anatomy book. I kiss it. I'm just joking, of course. It's the foundation of nursing. You need to love this class. And some of you are so nega. You know what's negative? Oh my God, I don't like this class. No, you can never do that because why? This is your future.
I understand.
You have to love anatomy, okay? Yes.
Doesn't the subdural hematoma have a 50 to 90% death rate because it's not usually treated right away and it can take like weeks to develop, so people die.
Okay, so
more
she's
often
giving
than not.
statistics, okay? Let's say it like this. First, let's go to anatomy first, okay? You're talking about statistical data, right? Okay.
No, I
Yeah, I know. It's okay. It's okay to come up with a discussion. Okay, it's like this. Listen to me. And I think some of you already knew about the answer because I probably discussed it in the lab. You discussed it in the lab? I think some of you already knew, right? That's why. If it's epidural, why is it more dangerous? Because it involves what? The meningeal arteries. While it's subdural, it involves what?
Veins.
Now, if you Google it and then look for the answer, they will give you the answer. Because Google was given the answer by humans, right? Google is not really smart. Because the information that are given to Google comes from who?
People.
Human brain. Okay, so now you would say, Dr. Gamo, is that really true? Okay, let's do an experiment. Who has a knife here or a blade? Okay, I will cut my artery and I will cut my vein. Who do you think will have a greater blood pressure? Okay, anybody who has a blade, come on. I'm willing to cut just to show it. I am a scientist, you are a scientist. We believe in what?
Experimentation.
Evidence-based medicine means proof beyond reasonable doubt that arterial bleeding is more dangerous than... Okay, now I'm just joking, of course. Wait. If I were to cut, how do I know? Where is the radial artery found? Is there what bone? Don't you love anatomy? Thumb, radius, little finger, ulna. If I'm asking you to palpate for the radial artery, where do I go? Radial bone, thumb, radial pulse. There's a pulse, there must be what? An artery, okay. If I cut that artery because the blood pressure will be higher or lower? Higher. Because it came from the aorta. Remember? Radial, brachial artery, axillary artery, subclavian artery, because it's below the clavicle, right? Remember? And it came from the aorta, and it came from the left. So the blood pressure is what? Higher. What about the veins?
Lower.
Where? In fact, do we ever get the blood pressure from the veins? No. Okay, now, if that person fell, sustained an epidural, Will the bleeding be faster?
Yes.
Will the bleeding be stronger?
Yes.
Will there be greater increase in the intracranial pressure?
Yes.
Brain drop.
Okay.
Brain herniation.
Yes.
When there is bleeding in the epidural space, it's arterial bleeding. If you cut the artery, fountain of blood. If you cut the veins, okay, now the question is this. How would that be compared to the meningeal arteries in the vein? The same thing. The moment you rupture the arteries of the meninges, the bleeding will be more massive, faster, and stronger. It will not be. So remember that what I told you about this 19-year-old guy? It's actually my cousin. He was not actually driving the motorcycle. He was just a passenger. So when he was, I felt bad because he was my cousin. He was my cousin. So he went to the hospital. He walked like this. Told the nurse, I fell. I hit my head on the pavement. I have a severe headache. He was having projectile vomiting, which is an indication of increased intracranial pressure. I hope you know what that means. The pressure inside the brain is very, very high because there's massive bleeding. The skull is hard. The brain is soft. Can the skull expand? No, because the sutures have fused, right? Okay, so with that kind of scenario, increased intracranial pressure, the brain what? Was pushed upward or downwards?
Down.
Why? Because there's a hole called the foramen magnum.
Yes.
So remember, the medulla oblongata is the respiratory center of the brain. So the medulla is here, the spinal cord is here, passing to the foramen magnum. Once the brain herniates, where does it go down? Or where does it go? Down or up?
Down.
Down. And what will the foramen magnum do to the medulla oblongata, which is the respiratory center or the breathing center of the brain? It compresses the medulla, you will stop. Okay, and you become coma. Unconscious. Okay. So after 10 minutes, he walked, told the nurse, became unconscious, never woke up. Intubate him. Now, this guy, remember the 70-year-old guy who was in the nursing home? He fell. He stood up, smiled, embarrassed a little bit because there was a pretty 70-year-old woman. Did you see that? And the woman, I'm okay, don't worry. Okay. And then one month or 6 months later, had a stroke. We did a scan. Lo and behold, what did we see there? A very small subdural hematoma that was not even affecting the brain of the patient. Why? Because the bleeding was fast or slow? Slow or very slow? Very slow. Okay. So I'm trying to exaggerate things, but if you do a research, if you Google it, they will explain it there. Okay. So the idea is that based on your background, you don't rely on statistical data because, as I said, especially if the data was given, I'm not saying that the data you got was right or wrong. All I'm saying is that you always justify the answer that you give. The reason why it is more dangerous with epidural bleeding because what is involved is what? The meningeal arteries that have been ruptured and destroyed. And that's why the bleeding is fast and stronger and more massive. You could be unconscious within 10 to 15 minutes. And there is therefore a need to what? What should we do? There is increase in the cranial pressure. There is bleeding in the epidural space. What am I going to do? Get to go to Home Depot, buy an electrical drill, and drill a hole and let the blood what? Drain out. Will that help decrease the intracranial pressure?
Yes.
Will that save the life of your patient?
Yes.
And I think I mentioned this in the lab. In one of the episodes of Grey's Anatomy, the intern there, the medical intern, Easy, I don't know. She was in the pier in Seattle. There was an explosion. This guy could not be brought to the hospital for the scan. So what they did was based on what? Assessment. Doctors and nurses do an assessment. Look at the patient. We talk to you. Sir, how are you? And the patient said, I'm okay. What's your name? My name is Mr. Smith. Where do you live? I live here, blah, blah, blah. And then all of a sudden, there was what? Sudden deterioration in the level of consciousness. Then obviously, what would you think of when somebody has a sudden deterioration in the level of consciousness? What organ? The brain, of course. That's how you think. So, now, when this is going to be seen in this patient, what did she do? Without a scan, she doesn't even know. Was it epidural? What did she do? Okay, anybody with an electrical drill? Of course, will you be a medical student? Will you be bringing a drill with you every time you go? No. So drill, look for, I think they just only boiled water and then what? Put the drill. That's how they try to clean and sterilize the device, the drill bit. Drill a hole, drill a hole, drill a hole, drill. The purpose of what was what? To let the blood drain out, save the life of this patient. Patient woke up, he lived happily ever after, okay? That's why all the time I always have an electrical drill in my car.
Even when you go to be there.
Okay, so anybody here who has problems, I can do it for free, okay? Now, what about meningeal veins? Not a going, unless of course it was such a massive amount of veins involved and it could probably be a problem, right? Okay, is that clear? Now, let's move on. So we talked about the dura, the arachnoid, and the pia. We talked about the meninges. Now we're going to talk about the ventricles of the brain, right? And we asked you about that a while ago. How many ventricles do we have? And you start with what? Lateral. There are two. Followed by what? Interventricular foramen of Monroe. Followed by the third, V. Followed by what? Aqueduct. Followed by what? 1/3, 1/4, but two lateral, one on both sides. And then after the fourth ventricle, what do you have? Median, aperture, and then what? Lateral. How many median?
2.
One. How many lateral? 2. One to the left, one to the right, and where do they all go? Sub, arachnoid space, around the brain, and around what? Spinal cord. In other words, the subarachnoid space around the brain is continuous with the subarachnoid space where? That's the reason why when we do a lumbar tap, remember I talked about this before? Yes. The spinal cord. A patient who comes to the emergency room with what? High-grade fever, alteration in the level of consciousness, and most importantly, develop what? Generalized tonic, clonic seizures with upward rolling of the eyeballs, with a rigid neck or stiff neck, with fever. Can you think of meningitis in this patient? Meningismus, neck rigidity, alteration in the level of consciousness, the meninges in the brain are affected. So why do we do a lumbar tap here? Because whatever fluid you get here is the same fluid that you find in the brain, around the brain. And that is why you send it to the lab for what? Culture and sensitivity testing, trying to grow the organism that is causing what? The bacterial meningitis. After one day we see the results, heavy growth of meningococcemia or meningococcus, and sensitive to this drug, ceftazidime, resistant to penicillin. Are we going to give penicillin?
No.
How can you give it with resistant, the organism? Are we going to give ceftazidime? Yes, we do. We are men and women of science. Does it make sense?
Yes.
Okay, now. Okay, so is this going to also provide some degree of protection to the brain? The CSF, yes? Okay. Now, based on your extensive readings, in the ventricles, you have lateral, you have third, and fourth. What exactly do you understand of the word ventricle? Yes? What's your name?
Kelsey.
Kelsey?
Yeah. It's a chamber where the cerebral
Chamber.
fluid is
So it's an empty chamber, empty space, but is it really empty? What is found there?
It's filled with CSF
Filled with CSF.
and a coracoid plexus that creates.
Now remember, the heart also has a chamber or ventricle, but this is not the same thing.
No.
It contains what? CSF. Okay? My question to you is, Kelsey,
Yes.
what produces the CSF, Kelsey?
The coracoid plexus.
And what exactly is it? What did you say?
The choroid plexus.
I heard coracoid.
You heard an extra.
I know. Choroid plexus, CHOROIDPLEXUS. Do I love spelling?
Yes, you do.
You should have good spelling. It's so embarrassing if you go to the hospital and your spelling is bad.
I spelled it right in my notes.
I know. Okay, what exactly is a choroid plexus, Kelsey?
It creates the cerebral spinal
What?
fluid.
Okay. Did I say what it would?
It's the specialized epidermal cells. Or
It's okay. Yes, young lady, what's your name? Melissa. What's a choroid plexus, Melissa?
I have the same answer as her. It produces cerebral spinal fluid.
And it's the specialized epidermal cells.
The capillaries and the
Capillaries and
coracoid
epidermis.
plexus.
And what is a capillary?
The smallest blood vessel.
And what is inside the smallest blood vessel called capillary?
Blood.
And what is blood made of?
Plasma.
And what is plasma made of?
Water.
And what is CSF mostly made of?
Water.
In other words, where did the raw material
Okay. So,
of the water of the CSF came from? It came from where?
I'm sorry, repeat the question, I wasn't. I'm sorry. I was gonna answer her question, I'm sorry.
Remember, when we do a lumbar tap, what do you get?
Cerebral spinal.
Clear water.
Yeah.
CSF is mostly water, right? In other words, what was the raw material used in the manufacture of the CSF by the choroid plexus?
Capillaries.
Was it the papillary or the blood plasma?
Oh, blood plasma. I'm sorry.
There you go! In other words, yep, to piece together all this information, where do you find the choroid plexus? Yes, my dear. The one who got 93 last time.
The wall of
What's your name?
Maciel.
Where do you find the choroid plexus?
The wall of every ventricle.
Is that in your notes?
Yes. It is
Exactly what is written in the book, right? Where?
the book.
The book or the wall?
Oh, the wall of every ventricle.
I have a feeling you might get another 93 today. Only a feeling.
Don't jinx me.
I will jinx you.
No.
So aside from the capillaries, they mentioned about what cell?
The epidermal cells.
Epidermal cells. Right? So we have epidermal cells at the same time, or what? Capillaries, right? Remember last time we talked about what? Epidermal cells. Are they considered neuroglial cells? Neuroglial cells.
Yes.
And they produce what?
CSF.
In other words, the CSF is produced by the epidermal cells, but I was not able to hear the word capillaries. So in other words, the choroid plexus is going to filter the blood, remove what? The water of the blood, convert that into what?
CSF.
And remember, therefore, because the wall of the lateral, the third, and the fourth have choroid plexus and epidermis cells, do they have the capacity to produce CSF?
Yes.
Each ventricle, therefore. Then how would they flow? Going down or going down?
Going down.
Why?
Gravitational.
Of course, see? Combination of physics. And not only that, it's formed this way, right? This, and then here. Now, the question is this. Upon reaching the subarachnoid space, what will drain or remove the CSF from the space?
Arachnoid villi.
Arachnoid villi, part of the arachnoid granulations, right? So is that arachnoid villi part of the arachnoid? Yes or no?
Yes.
Okay, so from here it goes into the arachnoid villi in the arachnoid wall, and then it drains the water and CSF. Where does it go? Dural venous sinuses. Bless you. So this CSF from the subarachnoid space will be drained by the arachnoid villi from the arachnoid granulations, which will bring the CSF where? To the dural venous sinuses, and from there, where are they going to be brought? To the veins of the brain, right? The veins. So the vein is a blood vessel, therefore it contains what? So what do you realize here? What came from the blood goes back where? Do you understand? It's called recycling. Why am I shouting again? I'm just stressing a point. I'm not angry with anyone. I'm just stressing a point that there is recycling taking place here. What was produced by the blood, from the blood to the blood, from the blood in the choroid plexus of each wall of the ventricles of the brain, and then at the same time going to the arachnoid villi. Now, I don't know if you watched the video. What did I compare this to? I don't know if it was there, because sometimes I do not compare, I do not use
I
that.
don't think you compared it. I don't think
Okay.
you compared it to me.
Have you ever taken a bath every day?
Have you,
I hope, right?
Have you ever taken a bath every day? That doesn't.
Means
Shower. No.
shower or take a bath with the use of a shower.
Okay.
Shower.
The shower head is what? Choroid plexus. And then it goes to your body, the ventricles. And what is down underneath there? The
Shower drain.
The drain. What will the drain do? Drain whatever soap, suds, water you have, right? So, choroid plexus is like the shower head. Shh. The ventricles of the brain, and then go to the subarachnoid space, and then finally, all the water should go where? Into the drain. Okay, now what happens most of the time? Like my wife and kids, they have a lot of hair. What will that hair do to the drain? Okay, so what happens now? If this is the meninges here, and you have meningitis, will the arachnoid villi be able to drain the CSF?
No.
No. Where will the CSF stay? It remains in the subarachnoid space. Same thing happens. When that drain is filled with hair, what will the hair do? Clog the drain. There will be no drainage. And what happens to the water inside the bathtub? And that is what we mean by the word hydrocephalus. In other words, there would be excessive accumulation of what? Water and CSF in your brain. But the problem is that in infants, it's okay. Because the sutures have not fused, what happens to their head? The skull will accommodate, will try to adapt. You end up with a baby with what? Big head. And that is actually nature's way of trying to preserve what? The brain of the baby. But can that happen to you? Can your head become bigger? No more, because the fusion has taken place in the sutures of your skull. But you still have hydrocephalus. The moment you have hydrocephalus, there is increase in the cranial pressure. What will that do? Can that also lead to brain herniation? Yes. Now I don't have to go into the details. You probably heard of the word VP shunt. You put a shunt like a small plastic catheter with a hollow tube. You put it in the lateral ventricles. That's what they call ventricle. VP stands for what? Ventriculo. And what is P? Peritoneal. What do you mean by peritoneal membranes here? So you put the shunt here, the plastic tube underneath the skin, and the neck, all the way what? The abdominal or cavity. So in other words, the fluid that is excessive here will what? Drain into the abdominal cavity. Will that save the life of your infant?
Yes.
Will that come out in the nursing board exam? In other words, you should never let the patient lie down or infant lie down on the side where the shunt is, because that will what? Destroy and damage the shunt. And the baby's intracranial pressure could go up and start to vomit and start to what? Have seizures. Okay? Will that come out in the nursing board exam too? Definitely. Okay? Do you understand? So did you understand the analogy I gave you with regards to the shower head and the drain? Now, we'll talk about the brain itself. When you look at the brain, you will observe that the brain is what? Smooth or has a lot of wrinkles? Wrinkles. Okay. So what is the term we use to describe the groove or canal? Sulcus. If it's more than one, sulci. What about the folds?
Gyrus.
What is it called?
Gyrus.
The gyri or the gyrus, right? Okay. So, can somebody give me a piece of paper, please, por favor? Thank you so much, Miss Julian Paul, right?
Yeah, that's me.
And I remember you emailed me about mastering A and P, which is not okay. What section are you in?
2-3.
I'm not sure. Maybe I'll check if it's the only. Sometimes I have so many 5 sections I have to manually, you know.
I think it's most people though.
In your section?
Yeah, I have it too. Mine too.
Okay, that's right. Other sections, no problem, right? Okay, look at this, class. This is the fold. This is the groove. This is the fold. This is the groove. What do you call this groove or canal? Sulcus. What do you call the fold? Gyrus, gyrus, sulcus. Now, may I already mentioned this before? What is the advantage of sulci and gyri compared to a smooth brain? Because what does it do? Increases the surface area. Very good. In other words, the more surface area, hopefully the more capacity to what? Store information and retain information. So which one would you rather have, a smooth brain or a wrinkly brain? Wrinkly. Okay. And I cannot forget, and I've already shared this with you before, I had the same question when I was what? Maybe 9 or 10 years old. I went to the library, and guess what? When I opened the book, there was no Google, there was no Bing, book. And I went to the American Missionary School, so we had books that came from here, from the US. It was 1960s. And it says there, the convolutions of the brain are brought about by the presence of sulci and gyri. which will increase the surface area. So information that then was also the same information I have now. Increased surface area. Will that also correlate with intelligence?
Yes.
Other forms of mammals, compared to the human brain, we have more convolutions, right? It means we have more storage area for retention and become smarter than the other forms of mammals, right? Of course, other forms will be, the other reasons for intelligence would be has to do with what? Genes, genetic, and what else? Neurotransmitters. We'll talk about that later. Now, sulci and gyri. If it's a deep sulcus, what is the term we use? Are you sure? Is that your study guide? You see what I'm saying? Some of you, I hope you did get that. What do you call a deep sulcus? Now, what is the name of the sulcus that divides the frontal lobe from the parietal lobe? Okay, and therefore, what is the name? So let's go over the lobes of the brain. What do you call the lobe in front of the brain? Don't you love anatomy? What about here? What about here? What do you observe? It's the same bones. The name of the bones are the same names of the lobes of the brain. What about here? Temporal bone, temporal lobe, right? Okay, what do you remember about the occipital lobe? What is the main function of the occipital lobe? Visual cortex, vision. What about the parietal lobe? Sensory cortex. But what is the specific area that is considered the primary somatosensory cortex? Post what? Post means after the central sulcus, there's a central, post-central gyrus of the parietal lobe, which is the primary sensory. What about the precentral gyrus of the frontal lobe? So everything you do is controlled by that area with regards to what? What is motor? Motor means muscle. Muscle means what? Movement. And which muscles are we referring to? Are we referring to skeletal muscles? Voluntary controlled by what? Now remember this, and we mentioned this before. The left side of the frontal lobe, in the precentral gyrus, if you remember the nerve fiber tracks, we compared them as if they were telephone wires. Left side, they go like this, right? Deep inside. I can, of course, cut my brain. Goes inside, and what? Upon reaching the medulla oblongata, what do? They cross what? To the opposite side, and they start going on the right side of the spinal cord. And the spinal nerves coming from the spinal cord, giving rise to the brachial plexus and lumbosacral plexus, will now control the muscles of the upper limb and the lower limb on the right side. In other words, left controls the right side of the body. What about the right brain? The left. Okay. So where do they cross? Now, what is another word for crossing of the nerve fibers? What is another name? Okay, listen to me. The more words you know, the brighter, smarter you become. Okay, what's another name for crossing of the nerve fiber tracks? Yes, anyone? Yes? What?
Decussity, I think. Is that what you're looking for?
I'm about to smile, but it's not perfect. What did you say?
I don't know.
Decussate.
Decussate.
Where did you hear the word decussate?
I read it in the book. Obviously, I haven't.
That you don't take it down notes. Is that in your notes?
In the previous chapters.
The answer is correct, but she was partially wrong. She said what? Decausticate. But I knew you knew. Do you know how to spell decussate? Mr. Thomas. So how do you spell decussate?
D-E-C-U-S-S-A-T-E.
You're the man! Decussate. But if this were a multiple choice question, you might be able, the two of you probably will get the answer, right?
I just say cussed.
Decussate. But what's a simpler term? Now, have you ever noticed some people come to me during an exam and they come to me and say, Dr. Gama, what does this word mean? What do I tell them? It's part of the exam. Because it will measure your what? Comprehension. So if I do not use the word cross, C-R-O-S-S, then I can use the word what? And where does the decussation of the nerve fiber tracts occur? And believe me, this is really true. I've been teaching for 30 years. It's always a game of words. Believe me, the more words you know, the more successful you become. Because if you know the meaning of the word, the more you will be able to what? Understand and comprehend, and hopefully you're able to better what? Retain the information. And that's the reason why when I speak to someone, I'm not trying to humiliate you or whatever it is. The kind of words you use when you speak to me, I can tell their IQ. I can determine how smart you are. I hope you can do the same thing when you become more mature in this field of nursing, right? When you talk to me and you say, oh, there is crossing of the nerve fibers at the level of the medulla, B. But if you say, there is decussation of the nerve fiber tracts in the medulla oblongata, then I'll give you an A minus. I'm just joking. Maybe an A.
What's an A?
In other words, when we look at level of learning and comprehension, believe me, the more words you know, the better for you. Because why? Because every time you encounter a word that you do not understand, what do? Look it up, and then forget or write it down on a piece of notebook. Write it down and look it up, okay? Do you understand? Now, so in the nursing board exam, are they going to ask you, where does the decussation of the nerve fibers tract occur? No. So this was going to happen. Listen. An 80-year-old male patient was brought to the emergency room with left hemiplegia. Now you'll be asked, where is the lesion located? The right cerebral hemisphere, particularly the frontal lobe, is involved. Right? Why? Because like telephone wires, what happens? The left side of the body, the right side of the brain, what? The fibers, what? Go down and what? Cross or decussate to the opposite side in the medulla oblongata, and they start to go down on the left side of the cord. Everything here, therefore, is controlled by the right side of the brain. Do you understand?
Yes.
So they will be giving you questions like a case scenario. An 18-year-old male patient was admitted with left hemiplegia. Hemi means what? Does anybody know what hemi means? Half. What does plegia mean? P-L-E-G-I-A. Complete paralysis. If I say hemiparesis, partial. So partial. Complete. No movement. Or just a twitch. You understand?
Yes.
Okay. Now, so we talked about the lobes of the brain, frontal lobe, motor cortex. What about here? Okay. Occipital lobe, visual, parietal lobe, sensory. Temporal lobe is what? What? Auditory core, which makes sense, it's already there, right? Okay. Now we talked about the basal ganglia of the brain. What are the three components of the basal ganglia? Caudate nucleus, putamen, and lobus pallidus. So in a nutshell, what does this part of the brain do?
Motor function of the movement.
Okay, it controls the movement because it controls motor function. And that is where you store the neurotransmitter called dopamine. We talked about dopamine before, right? Remember the word Parkinson's? Muhammad Ali float like a butterfly, sting like a bee. Because of repeated trauma to his head, did we destroy his basal ganglia? No, I'm not the one who did it, but maybe his opponents who were boxers, right? But obviously the dopamine is produced by the substantia nigra of the brain and then stored in the basal ganglia. Of course, if you lack the neurotransmitters, you develop what? You cannot what? Control your movements. Why? Because you have lost functions of the basal ganglia. Does that make sense?
Yes.
When the basal ganglia is intact, you can control the movement. The moment the basal ganglia is destroyed together with the substantia nigra, the dopamine levels in the brain goes down, you develop what? Are you able to control your movement? You develop what? Tremors. And bradykinesia. Brady means slow, kinesia means what?
Movement.
Brady means what? Slow, kinesia means movement. And what do we give these patients? Dopamine in the form of levodopa, but they have been shown to be good only for the first 2 or 3 months. So we're still doing a lot of research to find out what is going to be the best treatment. Do you understand? I mean, Michael J. Fox, Muhammad Ali. Okay. Is that clear? Now, what about when I say, I already talked about this a while ago, when I say diencephalon? Thalamus above is and below is? Okay. So another way to do this again, you do the same thing, you put what? Diencephalons, epi, Thalamus, hypothalamus, right? Okay. What is found in the epithalamus? What is the name of the gland that is found there? What?
Pineal gland.
And what does the pineal gland secrete?
Melatonin.
And what is melatonin for?
Circadian
Okay.
rhythm.
So,
Day-night cycle.
now you might say, Dr. Gum, there's so much information. I'm overwhelmed. But what can we do? This is a program where instead of taking it from 4 to 5, you take it only for what? 3 years or less. And the anatomy is how long? 9 weeks. In medical school, we take it for a year. See? So I'm not saying that it's easier because 1 year and yours 9. You have to adapt. That's how you have to survive, right? So if I say, hi, my name is pineal gland. What is your name? You can either say melatonin, you can also say what? Epithalamus, right? Okay. Hi, my name is pineal gland. What's your name?
Epithalamus.
Oh, I'm sorry.
Melatonin.
Right? Epithalamus, pineal gland. Okay, I hold your hand. Okay, hold your hand. If I go there, I cannot be seen with the video, okay? So if I hold your hand, hi, my name is Epithalamus. What's your name?
Pineal gland.
Okay, the other way around, right? And then hold her, and then what is your name? Your name is Melatonin. Okay, hold each other's hands. And what do you think should her name be? If you are melatonin, what should be the important word that should be associated with melatonin?
Rhythm.
Yes? Circadian rhythm. So what's her name? Hold her hand too. Hold her hand too on the left. I'm gonna hold your hand too. So we're gonna be holding like a circle, right? So what's my name? Pineal gland. What's your name? Epithalamus. What's her name?
Melatonin.
And what does melatonin do? So how many words?
4.
A few, 4 to 5 words. But that will make you get a perfect score in the exam.
Sure.
What are the chances of you not forgetting? Hi. You will always remember, right? Hi, my name is Epithalamus. What is your name?
Pineal gland.
Hi, what's your name?
Melatonin.
Hold your hand. You're related, right? You are the daughter of the mother. I am the grandfather. Okay, what's your name? Your daughter? Circadian something. You are indeed, you don't even know your name. Circadian something is not the name I gave you. What did your mother give you? Circadian what? There you go. Why do we need perfection here? Because we need you to know the right thing, right? Okay. You know what is circadian rhythm, I suppose, right? What is it? Yes, the woman near the wall. Yes, you. What's your name in there? Michelle? What do you mean by circadian rhythm?
Yeah.
What? Sleeping only? What happens after you sleep? You what? You wake up. Okay. It's a sleeping and waking pattern. Like me, if I sleep at 11 p.m., I wake up at 6 with or without the alarm clock, right? Sleep at 11 p.m., wake up at 6. Sleep at 11 p.m., wake up at 6. Now what happens if I have a class at 7 a.m. here, especially on Friday mornings for pathophysiology? What time do I have to wake up? 4:30. Do I need an alarm clock? It's a little far, right? Okay. You understand? So circadian rhythm, with or without the alarm clock. Without the alarm clock, I should be able to wake up at 6 p.m. a.m., right? 6 a.m. Because it is already a pattern, right? Do you understand? Now, we talk about the thalamus. Give me one word or 3 series of words. What is exactly this important role? Okay, relay station for what?
Sensory.
Oh, yes, Miss Paul?
Sensory relay.
Sensory relay. So, if somebody will pinch me. It goes to the sensory nerve, goes to the spinal cord, crosses, and then eventually ends up with the thalamus and goes where? To the parietal lobe. And I feel the pain. Right? It's a relay station. It says, hey, you know what? You go to the visual, you know what? It's like the border patrol, you know? It directs you where to go, right? Or it's a relay station, right? Now, what about the hypothalamus? Why is the hypothalamus so important? It controls the pituitary gland. That's why it's called the master of the master gland. It controls the pituitary gland, which secretes, my goodness, so many hormones, right? Now, what else? What else can the hypothalamus do? Yes! Yes! Very good.
Appetite
And
control.
remember this. In the nursing board exam, they would say, A patient was brought to the emergency room, and upon admission, within the first day, the patient's temperature patterns were going up and down. So they will ask you, what do you think is, what part of the brain is affected here? And of course the answer would be, because it is important for what? Temperature what?
Regulation.
So now, going to the game I made. Hi, my name is hypothalamus. What is your name? Temperature regulation. What other name could I give you? What does it do?
Appetite control.
Of course. And that's the reason why
Mammillary fog.
people who want to lose weight, you know, what is the basis for these medications we give? It's science. They know that certain drugs will act on the hypothalamus, which happens to be the appetite, or what we call satiety center, which means you're full or hungry, right? So, if you can just manipulate these drugs to have an effect on the hypothalamus, the appetite center, then with just 1 teaspoon of food, I'm full. And I will be able to lose weight and come up with a sexier booty. You understand? Okay, now, if I say emotional brain, what comes into your mind?
Limbic system.
The limbic system. Now, I meant to be, I don't know if I already mentioned it's a joke before. But what do most people do during Valentine's Day? Valentine's Day, they will say, honey, I love you with all my heart. That's the most stupid thing you can say. Because the heart has nothing to do with the word I love you. Because what is the function of the heart? It pumps blood. It's a muscular pump. Therefore, every time you tell someone, honey, I love you with all my heart, honey, I love you with all my muscular pump. Because that is what the pump or the heart will do. So in other words, what am I trying to say here? Honey, I love you with all my, honey, I love you with all my.
Limbic system.
Now, what is in the limbic system that is important for long-term memory?
Hippocampus.
Is it hippopotamus or hippocampus?
Hippocampus.
And how do you spell hippocampus, my dear? Okay. Hippocampus is important for long-term memory, and is that part of the limbic system? Yes. So have you ever realized the correlation? When you are happy, emotionally happy, will it be easier to understand what you read and be able to retain the information? Yes. Of course. What happens if you have a fight with your boyfriend, or a fight with your kids, a fight with your wife? Your emotional aspect is not proper. Will that affect your ability to learn?
Yes.
Will you be able to concentrate during an NCLEX board exam? That's why I tell my people, I tell students that when you are about to take the nursing board exam, do not fight with anyone because you don't want to be in the proper frame of mind. Yes? Yes?
But when you're actually arguing with someone, or if you've just had something like that, it's easier to remember things.
Yeah, that's right. In memory though, I'm talking about memory, right? In the development of memory, it says that if there's an emotional component, I don't know if you can correlate this with the testimony of, I don't want to go into politics, but remember the Dr. Blasey Ford? She's a psychologist and neuroscientist. What did she say? The effects of epinephrine and norepinephrine on the, he mentioned the word what? She mentioned the word hippocampus, right? On long-term memory. Because apparently, I don't want to side with either Democrats or Republicans, because for her at the age, was it 14 or 15, in a high school party or something, somebody, I don't want to mention the name, assaulted, supposedly that guy assaulted him. And when you are in a situation, you're helpless, somebody is putting his this, it's traumatic, and they have a more vivid memory, or some cases they actually would try to forget it, but it keeps on recurring and recurring, right? So this is true. I remember the first time that I almost died. This was
The first time? Thank you.
I almost died. I'll tell you why. This was, I come from the Philippines. I migrated here like 16 years ago. I'm now an American citizen. To cut the story short, I was, when the former president of the Philippines, Marcos, was being dethroned and sent. So when his helicopter was, so we thought, oh, he's no longer in the palace, right? So I was working in the hospital with medical interns of us. We went to the palace where the president used to stay. And of course, we took our cars, wearing white because we thought that maybe by wearing white, oh, they're doctors, we're going to save them. Right? As we entered the palace, Jesus, my goodness, I could see the bullet, M16 rifle. Oh my God, I think my testicles, it went up to my... I ran, I think if I joined the Olympics, I could have won the 100-meter dash. I'm not kidding. Now, do I still remember up to now? This was 1986. And what year is it now? 2018. I cannot forget because it will only take one bullet to hit my head, I'll be dead. I won't even be here today. Man. So, survival. And we'll talk about that later, sympathetic response. If I joined the Olympic, I really would have won. We ran as fast as we could because there were still forces loyal to the deposed president who were trying to fight off the other forces. So anyway, that's why it's important. Okay, now anyway, so limbic system, hippocampus, memory is more vivid as you write. You're right. It makes you remember things, right? Okay, and it happens. Now, in the brain, right? We talk about the cerebellum. What is the cerebellum for? And this is actually in the discussion board, right? I don't know what, some of you did talk about superficial injury. Okay, it talks about the spinal cerebellum tract superficial injury on the track. So you were trying to define the word superficial. I said, okay. So what is the function of the spinal cerebellum tract? It's for the discussion board, right? You already answered that, right?
No.
No,
Last week was epidural.
Am I talking about anatomy class?
This week was epidural and subdural, and then the one
And
before
the one
that.
before that was the spinal.
Did you already answer the one on spinal cerebellum, right?
Yes.
Yeah. Okay, so my question is this. What is the spinal cerebellum tract for? What is spinal cerebellum tract? It means what? The nerve fiber tracks from the spinal cord all the way to where? The cerebellum, right? Remember the telephone wires that we keep on talking about? Nerve tracks are like telephone wires. Spinal cord all the way to the cerebellum, right? And some of you mentioned about first neuron, second, which is good. Some of you have 2 or 3 paragraphs as answers. I said, okay, which is good, right? I mean, you did your stuff. You were doing a lot of research, right? Mr. Barrera, how many paragraphs did you have?
70.
I think you had 3 or 4 or 5 paragraphs, right?
It was like an essay.
I know, it was not an essay, it was a book. I'm just exaggerating. So, now I know some of you, oh, I just want 1 paragraph, you know, I want 2 or 3. It's really up to you. It's up to you because who's supposed to benefit with this? You or me? You! I know this stuff already. So hopefully he remembers what he wrote there, right? Do you remember what you wrote there, Mr. Barrera? I think you probably have 4 or 5 paragraphs just for your initial response, right?
I started to explain the classification of neurons that helped me understand.
I understand. You talk about first, second neuron, and then... And you mentioned about what is the most important function that, you know, we talk about what? What is important for the cerebellum is balance and then what? Coordination. At the same time, you mentioned about what is proprioception. What is proprioception? Position sense, right? Okay. Position sense. Example, if I am testing a patient for proprioception, close your eyes, okay, open eyes, up, down, up, down. Okay, close your eyes, sir. What is this? Up. What is this, sir? Up. What is this? Up. What is this? Down. What is this? Down. I'm a normal person if I can tell that with the eyes closed, right? Okay. So, and not only that, you talk about why do you think I can do this? Balance. Now, what about finger to nose test? I tell the patient, okay, touch your nose, touch my finger. What am I testing for? Coordination. What about this one? Put the arms or hand on top of your lap. Again, coordination. If there is no coordination, what happens? One like this, one is like this. No coordination. At the same time, balance. If I let you walk like this, normal. If you have a patient who is not drunk, but walks as if he is drunk, what part of the brain is affected? Cerebellum. Would I recommend a CT scan of the brain? Which part of the brain? Cerebellum. I can also let you stand. It's called the Romberg's test. Testing for ataxia or lack of balance, ATAXIA. What happens if they don't have no balance? They sway to one side. Will that come out in the nursing board exam? Yeah. Don't worry about it. I will not ask that. Okay? So, lack of balance. Now, cerebellum, talk about all of these things. Now, so we talk about all the functions and more or less the lobes of the brain, right? Okay? Now cranial nerves. How many cranial nerves do we have?
12.
Remember? CNS, brain, spinal cord. PNS, cranial nerves, and spinal nerve. Because anything that arises from the brain, cranial nerve. Anything that arises from a spinal cord, spinal. How many pairs of spinal nerves do we have?
Oh, spinal?
31.
31.
Again, before you answer, you must what? Not even before you think, you have to listen. Listen, then you do what? You think. How many pairs of spinal nerves?
31.
How many cranial nerves do we have?
12.
Cranial nerve number 1.
Olfactory.
Okay. Put the number 1 where? On your nose. Sense of, oh shit, stool. Sense of? Smell. What about 2? Sense of? Sight. What is 3? For what? Which muscles of the eyeball?
The rectus muscles.
You have to be more specific than that, my dear.
All the rectus.
All the rectus, superior, medial, inferior, except what? Lateral. Why? What is lateral rectus? Abducens. Cranial nerve number 6. What about superior oblique? 4. Trochlear. Cranial nerve number 4. All the rest would be what? 3. Oculo, eye, motor movement muscle. What is 5? So 3 is oculomotor. 4 out of 6. 4 trochlear, superior oblique. Hi, my name is trochlear. What is your name?
Superior oblique.
Hi, my name is superior oblique. What is your name?
Trochlear.
Cranial nerve number?
4.
Number? What about 5? 3 branches. Ophthalmic branch, maxillary branch, and then what? V1, V for 5. Remember Roman numeral 5? V1, ophthalmic branch. V2 is what? Maxillary branch. What is this? If I have a toothache involving the lower teeth, what branch is that? Mandibular branch. What about the upper teeth? Toothache. What about if a dust particle enters my eye and I have pain in my eye? V1, ophthalmic. It's not optic nerve, therefore.
That's
It's
the
what?
sensations of the face, right?
Sensation of the face, pain of the teeth, toothache, eye pain. Yeah, what are the chances you would put facial nerve for facial sensation? Very high. It's actually 5. So sensation of the face. V1, V2, V3 is responsible for the sensation of the Is it 5 or 7?
5.
Why? What is cranial nerve 7 for? Or otherwise known as facial nerve for the muscles of facial?
Facial muscles, expression, muscles.
You understand?
Yeah.
So, cranial number 6? What muscle? You're so smart. 7? Facial nerve? For what? Facial. Don't you love anatomy? How can you miss that, right? Facial nerve, facial muscles of expression. That's the reason why if the facial nerve is destroyed because it comes out here, you lose what? This gets paralyzed. So if you would ask me to contracts, paralyzed. I can even close my eye. Right? What about 8? Vestibulocochlear. We had this in the AR last time, right? Vestibule, cochlear. Organ of hearing, organ of corti in the cochlea. Cochlear nerve. What about vestibule together with semicircular canal for what? Equilibrium, right? That's the reason why we used to call it what? Auditory nerve. We changed that to what? Vestibulocochlear nerve because the ear has both functions of hearing and what? Balance or equilibrium. What about 9? Glossopharyngeal nerve. Innervating what part of the tongue?
Posterior 1/3.
Posterior 1/3. What about the anterior 2/3 of the tongue? Sense of sensation is what?
7.
Facial. Sensation of sense of sensation. Taste buds, right? What about posterior 1/3?
That's glossopharyngeal.
9. So how do I remember that? Dr. Gamo, I need to put what? 7 in front, anterior 2/3, and what do I put at the back?
9.
Posterior 1/3. 9. What about the base of the tongue?
The vagus nerve.
And what is vagus? 10. Right? Okay, what is 10? Vagus, right? At the base of the tongue, sensation of taste. And what is the most important function of the vagus nerve? It's part of what system? Parasympathetic? Or
Parasympathetic.
okay. In fact, the vagus nerve is coming from the medulla oblongata, the brainstem, It is the longest cranial nerve. You know why? It goes down to the neck. It innervates the heart to make it beat slower, parasympathetic. It goes down to the lungs to make it what? Cause bronchoconstriction. It goes down to the stomach to increase more what? Acid secretion. Because remember, parasympathetic for what? Digest and rest. It goes to the intestinal wall and cause what? Peristalsis. Does that make sense? Is it the letter for the longest cranial nerve? All the way down. So what happens in Vegas stays in Vegas. What happens in Vegas stays in Vegas. Cranial nerve number?
10.
Now what about 11?
Accessory.
What muscles are innervated by 11? Sternocleidomastoid and trapezius. And finally number 12.
Hypoglossal.
And what does glossal mean? And where is it found? Above the tongue or underneath the tongue? Because what does hypo mean? Don't you love anatomy and terminology? So this nerve is responsible for what?
Movement of the tongue. Motor.
Motor function, motor movement of the... Does it make sense? Okay, let's talk about autonomic nervous system. Autonomic nervous system, key words to remember. It's involuntary, right? Okay. So you have two parts. What part do you have here?
The sympathetic.
Sympathetic and then what? Parasympathetic. And what is responsible? Let me just get the eraser. Again, as I have always mentioned to you, class, a concept map. How many of you tried to look on? You have subscribed to YouTube, right? Did you see that topic I talked about, concept maps?
Yep.
Which I did at the Asbury Farm here in Buena Park near Anaheim where I live. A map is a what? A tool used to learn because it gives you direction to where you're supposed to go. What is our direction for you to learn, right? So in other words, if I say autonomic nervous system, it could either be what?
Sympathetic.
And?
Parasympathetic.
So which among the two would be responsible for the fight-flight response?
Sympathetic.
You're afraid, what do? Flight. So example, the building is on fire. What should I do? What is flight? Get out of the burning building. What will be your guide? The exit sign, right? Because if this were to be a building on fire, what happens to the electrical current? Shuts down. Am I going to use the elevator? Use the stairs. If it shuts down, there's no light. I would expect that green light to be on to guide me where to go, right? So what happens to the pupils here?
Dilation.
Again, what is the purpose of the fight or flight? Survive. How many of you would like to die? No one, including me, right? Survive. For you to survive, what should happen to your pupils? Dilate or constrict? What about the heart rate? Up or down? Why would it be elevated? You have to pump more blood where?
For your brain. For your
Brain. Why brain?
To
To think properly, instead of using the elevator, I will use the stairs. What else?
Also for your limbs, though.
The lower limb muscle that you can run away, right? Do you want more blood to the skin?
No.
No, the skin is useless at that time, right? You want the blood to go to the vital organs, such as what? The brain, the heart itself, and the lung. Plus, of course, your what? Lower limb, because you want to run away, right? Which makes sense, right? Okay. What about the bronchioles? Bronchodilate or bronchoconstrict? Because you want to have more oxygen coming in, so that it can go to the muscles and more oxygenation, right? Okay. What about your acid secretion in the stomach? It goes down because there's no time to make digestion take place, right? What about peristalsis? Okay, slows down the peristalsis because there's no time to make poo-poo, right? So this will slow down, you become constipated, right? Because why? There's no time to make poo-poo. What about the urinary bladder wall?
Relaxes.
Okay, why relax?
There's no time to pee.
The muscles has to relax to be able to accumulate what?
More fluid.
More water or urine, because there is no time to make wee-wee. Relax. Do you understand? But you have to make sure the sphincters are closed, which is voluntary. Somebody asked me, Dr. Gum, how come it's very stereotyped, this big guy, let's say 8 feet or 7 feet, guy is 5 feet, and why would we make wee-wee on his pants? He's just so scared. I'll tell you why. Normally, in a real situation, like me, I'm 5 feet 9 and 3/4. Yao Ming is 7 feet and 6 inches. Shaquille O'Neal is 7 feet 2 inches. Both of them are 7-footers. I'm a 5'9" footer.
Okay.
If I challenge them to a fight, what are the chances I will survive? 0. They're so big, I'm so small, right? So what will I do? Run away, right? Run away. Okay. Why? Because I want to what? I want to survive, right? Does that make sense to you guys? To survive, run away. No. Like road rage, right?
Wait, why do you pee when you're scared then sometimes?
Okay. Whenever that happens, you're so scared, you were not able to control your sphincters.
So then my sympathetic system fails me.
Okay. The sympathetic is working. Relax the muscles in the wall of the urinary bladder, but the external urethral sphincter is what? Skeletal.
It's a muscle.
Voluntary. So these people who make wee-wee on their pants, it's because they are so scared they forgot to make their muscles what? Contract.
They forgot to tell themselves to not pee in their pants.
Well, that is the only scientific, logical explanation that could happen, right? Normally, the first thing I would do is run away. Now, have you ever seen this on television or the movie? If somebody's pointing to you with a gun, what should you do? Run away or just stay? And what do most people say? Shoot me, shoot me. And then if the guy shoots him, why did you shoot me? Have you ever seen that? So when people do that, don't ever do that. Because people in a situation where they're so angry, and you tell them to shoot them, what do you think will they do? So please don't ever say that. You go to a person with a gun and you have no gun, and you tell that person, shoot me, and he shoots you, and then you ask him, why did you shoot me? And the gunman would say, why? You told me to shoot you, that's why I shot you. I'm just making it as a joke, but have you ever realized? Think. Your goal is to survive. If somebody has a gun and you have no gun, what do? Run away if you can, but if not, just hide. Or what else? So, but the point is, whenever there is a situation like this, you have to be able to what? Remember, your goal is to survive. You want to survive, that's why you have to what? Run away from the burning building or somebody with a gun, right? Like this room, God forbid, there is a shooter. What do we do?
It says
Look on
run,
the back of
hide,
the
and
ID.
fight.
Oh, what?
It
What does it say?
says fight on it.
What do we do?
Run, hide, and fight. It says run, hide, and fight.
Run, have an escape, hide, find out.
Okay.
Fight,
Oh,
wait,
okay.
wait, wait, wait.
What about if there's an earthquake? You know what to do during an earthquake, right?
I imagine can
Get under a desk and under a choice.
Okay. Anyway, let's go on. Let's move on. Okay, so that's how important it is, right? Now, with regards to the sense organs, I think some of these already been discussed in your AR, right? But let's just go over them, right? Let's start with the ear, the simplest ear. Okay? The ear is divided into 3 parts. What are the 3 parts of the ear?
External, middle, and inner.
External ear, where you have the pinna of the auricle, made of elastic cartilage. Then what is this? Where the 3 bones are found.
Middle.
So external ear, the middle ear, where you have the what? The malleus, incus, and then what? Okay. So which one is attached to the eardrum or tympanic membrane? Malleus. So when the sound waves enters the external auditory meatus or ear canal, the sound will cause the eardrum or tympanic membrane to vibrate, causing the malleus to vibrate. It will also cause the what? Incus to vibrate, and then followed by what? Which looks like a stirrup, right? So the malleus is like a mallet or hammer, incus is the anvil, and the stapes, the last part, is made of a structure that looks like what? The stirrups. Okay? And the stirrups or stapes is on the what? Oval window. So when that is going to vibrate, what happens to the perilip and endolip? It will move. To cut the story short, it will cause what? The stimulation of the hair cells inside your organ of core T, which is the organ of hearing found in this structure called the what? That looks like a what? Snail. Cochlea. So what is the nerve that goes to the cochlea? Cochlear nerve. What is the nerve that is going to the vestibule? So they're combined, you have the vestibulocochlear nerve. Now, what do you call this like Six Flags? Semicircular canals for what? Dynamic equilibrium. Like remember the example I gave you in the lab, like what, the ballerina? They are moving, but they can maintain their balance. Dynamic means movement. What about static? I'm sitting right now, you're sitting. You can what, do this and do that. I don't have to go into the details there. It's called what? Static equilibrium. The vestibule. Remember the word saccule and utricle. Okay? Is that clear? So, cochlea, vestibule made up of the utricle and saccule for static equilibrium, semicircular canal for dynamic equilibrium, right? What's the name of the nerve? Vestibulocochlear nerve is not only for hearing but also what? Equilibrium. So people with vertigo, have you heard of vertigo? Yeah. When you feel the world going around like this, it could be what? Infection or inflammation of the inner ear, which is called, now this looks like a labyrinth, like a maze. It's called labyrinthitis. Labyrinthitis. Like me, from time to time, I have this problem, vertigo. My cousins have it. Of course, we come from the same genetic traits. I don't think of it's a faculty defect, but faculty defect. Oh my God. I remember when I went to see a patient, I have to sit down, okay? Now, what do you call this tube here?
The eustachian.
Auditory tube, eustachian tube, also known as the pharyngo-tympanic tube. Pharyngo because it goes to what? The nasopharynx. Tympanic because it goes to the tympanic membrane and the tympanic cavity, which is the middle ear cavity. AR, remember? Middle ear cavity. And therefore, is there a connection between the throat or pharynx and the middle ear?
Yes.
That's why when you have a running nose or coughing or sneezing, is it possible the bacteria there could go to the middle ear, passing to this tube? You end up with middle ear infection, also known as otitis media. Do you understand? Otitis, auto, ear, itis means inflamed or infected, media means middle ear. You understand? Okay? And I think, I mentioned this in the lab, we put even a laryngotomy tube to drain the pus. Once you have a pus there, it means there's infection. It can destroy your malleus, incus, and stem. You could become permanently what? Deaf. Okay? Is that clear? Now, what about the eye? Well, the eye, very simple. How many extraocular muscles do we have? 6. Extra means outside the eyeball. What is the one on top?
Superior.
Superior what? Rectus. What does superior mean? Top. What does rectus mean? Straight. Like rectus femoris, rectus. What about on the side here?
Lateral.
What about on the near the nose?
Medial.
And below?
Inferior.
And what is the one that with a pulley? Superior oblique. Okay. What about the one below?
Inferior.
Now remember these. So everything is oculomotor or cranial nerve number 3 except 1, superior oblique, which is what? 4, trochlear. Everything is 3 except for superior oblique, which is 4, and what about lateral rectus? Abducens, or what we call cranial nerve number 6. So you might be wondering, do I really need to know that, Dr. Gama? Very simple. Okay, remember class. Okay. If I move my eyeball, and I discussed it in the lab, if I move my eyeball to the right, for this I need my lateral rectus. What do I need here? Medial rectus. Now, let's say I have lateral rectus palsy. What is palsy? Paralysis of the lateral rectus because there is damage to what? The abducens nerve on the right, maybe because of a brain tumor or something that is compressing it, right? So when the abducens nerve is damaged, will I be able to do this? No. The lateral rectus will be paralyzed. So normally, if it's normal, what? See, my eyeball can move to the left without moving my head. Right? Left. So I tell the patient, ma'am, okay, can you please come over here? I hope you don't mind. Okay, let's pretend she is a patient. And what's your name again, my dear?
Marcial.
Marcial, okay. So, I want to use my fingers, right? Okay. So, look at your classmates. Okay. So, I want you to follow the movement of the finger. So, if I let her move her eyeballs to the left, what is she using on the left side of her eye? Lateral rectus. What about the right eye?
Medial.
Okay, what about this one?
Medial.
Medial on the left and then lateral on the, now up. Superior rectus? Okay. What about superior oblique? Remember, that's the one for cheating, right? Okay, pretend you're cheating. Look at my answers. Okay. Okay. So, let's say if I tell her to move to the left, this does not move. It stays on one place. That means the lateral rectus is paralyzed. What nerve is involved in the right side? Abducens nerve. Do you understand? Because why? And you end up with what? Double vision. It's called diplopia. Now, somebody in my class did the squint, the cross eye. Can you do that? Oh my God, she's so good. Okay, okay, show them. Thank you. Let's give her a big hand. I don't know if I can do the same thing. Okay. So you might be wondering, what the heck? It only means one thing. If there is an imbalance in muscle strength, which means that the lateral rectus muscles are weak, and what is strong?
The medial.
That's why they're moving this way. Does it make sense? Cross-eyed, right? Cross-eyed. So, is it important to have that surgically corrected as soon as possible? Especially for children, right? Don't wait before it's too late, right? You understand what I'm saying? Okay. Now, and I think did you have a nice time having your eye and ear test last time with the eye, especially the eye? It was really challenging, right? But somebody got a perfect score in my class in the A. Who got a perfect score in the... You're the only one who got a perfect... Of all the students in this university, even last term and this term, you're the only one.
On the AR?
For the eye, right?
Yeah, it was hard.
It was hard.
I got a 3 on AR.
But still, to get a perfect score, amazing. Okay. Because there, remember, we went through all the layers, right? Layers and layers and layers. Okay. If I were to touch this part of the eye, what is this called?
Cornea.
Cornea. That's where you put the contact lens, right? Contact lens, cornea. And then the cornea is an extension of the white part of the eye. What is that part? Sclera. All the way to the back. If I were to remove the sclera like this, what would be the next layer? Choroid. Remember the brownish thing? It's vascular. And if you move it forward, it becomes what? The iris and the ciliary body. Right? If you move forward. And the iris, in fact, is a continuation of the choroid here. And the iris is the one that gives the color to what? To your eye. Second, the iris being a muscle, it can either constrict or what? Dilate, depending on the light. If it's bright light, constrict. If it's dim light, like in a movie house, dilate. Sympathetic, dilate. Parasympathetic, constrict. Now, so is the ciliary muscle an intrinsic muscle?
Yes.
Or intraocular muscle?
Yes.
What does intraocular mean? Inside the eyeball. What does extraocular mean? Outside the eyeball. There were 6. Inside would be the iris, which regulates the size of the pupil. Second, the iris gives the color to your eye. How many of you have blue eyes here? 1, 2, 3. How many of you? These are not contact lenses, I suppose. I'm just kidding. So, Miss Etner, blue. Julian, blue. And what's your first last name again?
Campanoni.
So that's also blue, okay? So where did you get this? From your parents, of course, right? So you got it from your parents, right?
Yeah, my dad has blue eyes.
Yeah. What's your last name again?
Campanoni.
Is it Italian? That's right. Do you know I have also Italian blood?
Or
Gamo? If you go... This is not a joke. So I tell her, Dr. Gamo, really? You have Italian blood? Every time you go to Vegas, remember? Ferragamo. Salvatore Ferragamo is my uncle. I'm the Asian Italian.
you do the accent really well.
No, I love to eat spaghetti. It's spaghetti. Now, why do you think I'm tall? Most Asians and Filipinos are 5 feet, 5'4", right? But I am 5'9". So I joke about it. Maybe that's my Italian grandfather. He came from Europe. He went to the Philippines with the Spaniards, and he had his sperm, you know. Because my last name is not very common. I'm not kidding. So I have a feeling that we are related, maybe. You're the European side, I'm the Asian side. So, Dr. Gamo, are you sure? Yeah, Ferragamo and Dr. Gamo, don't they rhyme? Okay, now, the ciliary body. Does anybody know what is attached to the ciliary body or ciliary muscle? The lens, very good. See, my cousin is smart, no? This lens. Okay, so this is the reason why it can what? Accommodate. Like when you move an object far or clear, you can what? Because the thickness of the lens can what? Either become thin or thicker based on the contraction of what? The ciliary muscles attached to the rings, what do you call that? The zonules, right? Okay. So as you get to be 40 years old, what happens to the lens? It becomes what? Rigid. So you need reading glasses. Reading glasses. It's called presbyopia. Don't have to write it down. Presbyopia. Signs of old aging, right? Okay, now. So what are the two muscles inside the eyeball? Iris and ciliary body or ciliary muscle. Is that clear? Now, if you remove the cornea, what do you call the semi-liquid gel there? It's called aqueous humor. And then behind the lens, it's called vitreous humor. Right? So aqueous humor in front of the lens, behind the cornea. And you have the ciliary body there and the iris. So the anterior and posterior chamber. Okay. And then of course at the back you have the vitreous humor, just like a semi-liquid gel. And in the third layer after the sclera and the choroid would be what? The retina. What do you have in the retina? The rods and the cones. Which one is important for dim light? Bright light. Color vision. So if you're color blind, there's something wrong with your? What about night blindness? Because what is rods for? Dim light. Night blindness, right? Do you understand? Now, in the eye, and I think it came up in the AR, there was this area called the fovea centralis. That is considered the area of greatest visual what? Acuity. What is acuity? Sharpness. A-C-U-I-T-Y. Visual acuity. If the light rays goes there, what happens? Everything I see is very clear. Because it's all purely mostly made up of what? Cones. Cones, right? Okay, cones. Fovea centralis. How do you spell fovea? F-O-V-E-A. On the other hand, what is the opposite? Blind spot. The optic what? Blind spot? Hi, my name is Optic Disc. What is your name? Hi, my name is Blind Spot. What is your name? Hi, my name is Greatest Visual Acuity. What is your name? Hi, my name is Fovea Centralis. What is your name? Greatest Visual Acuity. Hi, my name is Color Blindness. What is your name? Lack of cones. Lack of? Because cones are for?
And bright.
Very good. Color vision. Do you understand? Now, so what's the difference between nearsighted or myopia and being farsighted? Farsighted, another name for that is what? Hyperopia. What is nearsighted?
Myopia.
Which one has a longer eyeball?
Myopia.
Shorter eyeball?
Hypo.
Hyperopia. Okay. So, and I think I discussed it in the lab. You need glasses, right? Because once I give the glasses, it will correct the error of refraction. What is refraction?
Bending of
Bending of the light.
My goodness, where did you hear that bending of light?
on your YouTube.
I did that?
Yeah.
Really?
Yeah.
You're not even in my lab class, right?
No.
Under Miss Mark? It's my YouTube video?
Yeah.
I talked about...
You said myopia, hypopia.
That's good.
I can't say it.
How many of you are myopic here? How many of you are hyperopic? Really? Hyperopic? It's very you're so young. Hyperopia means short eyeballs. Okay, one more time. How many of you are suffering from hyperopia? Okay, how many of you are suffering from myopia? So we're all cousins. That means we were given a long eyeball. How many of you have normal eyesight up to now? Raise your hand. Oh my God, I'm so envious. Mine is so... How many of you have a grade above 700? I think mine is 650 to 600. Okay? Okay, so... The idea, therefore, is this. We talked about vision, we talked about taking care of the eye, and of course, we talked about nearsighted and farsighted. Okay? I think we're going to end there, and then I'll give you a 5-minute break. Go to the restroom. I will give the quiz.